Okay. Good afternoon, everyone. This is Veronica Volchik, Chair of the Council for Human Services. What I'd like to do is first establish quorum. So we have Sue Mintonen. State your name.
Sue Minton, present.
Okay, Amanda,
Amanda Wright, present.
Suzanne,
Suzanne Keating, present.
Sarah Wright,
Sarah Wright, present.
Kelly,
Ellie Steffen, present.
okay, Tara,
Sarah Restieri, present.
and Veronica Volchik present. So we have 5 on Zoom and Tara and I are in person. Also, staff, when I call your name, please respond. So Sheriff O'Malley,
In attendance?
all right, and that is it. I don't anticipate any speakers today, so we can move on. So in accordance with chapter 20 of 2021, we are doing this meeting in a hybrid fashion. So it is being recorded, so please take note that anything that is can be seen on screen could possibly be seen. So also, because of that, we will do any roll call needs to be done for everything because of the hybrid nature. And I think that's about all that I really need to say on this entire 2-page, script. All right,
I'm
So-
hoping to get like an official revised abridged version.
that would be wonderful. Okay, but I know that other committees it's short and sweet and no longer reading this whole thing, so that's wonderful. So on the agenda, we've established quorum, and the next item on our agenda for today is acceptance of the agenda. So can I have a motion?
I'll make a motion.
Second.
Okay, Sue,
Aye.
Amanda,
Aye.
Suzanne,
Aye.
Sarah,
Aye.
Kelly,
Aye.
Tara,
Aye.
and myself, aye. Alrighty, next item on our agenda is approval of July 25th minutes. Do we have minutes?
Were they not sent out with the packet?
No.
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 Then we do not, and we'll have to get those and this one approved and sent out. They have to be sent in with the agenda, and I had assumed that Lexi had done that.
Okay, I personally and
I
Tara,
didn't,
we did
yeah.
not.
All
get
right,
it.
let me-
I will go back and check where Tara, if you can.
No, there's possible that it did not, but it would be attached to the PDF packet. So what I will do is I'll talk to Lexi about that tomorrow when she's in, and I'll send you guys out the copy, and then we can approve that and today's minutes at the next meeting. I'll make sure we stay on top of that.
Okay, thank you very much, and I do appreciate that. I know that Lexi is relatively new in this role, but we are hoping to
Not get behind.
not get
minutes.
behind and tighten the procedures, et cetera. So appreciate that very much. Okay. So on to the next item is public comment. I don't believe we have any public with us, so we can move on. We're really barreling right through this today. So item 5 on the agenda is election of the chair, co-chair. Do we have any nominations from the floor?
I would like to nominate Veronica for chair.
I second that.
Wait a
Thank
second.
you. Thank you. So, I don't know if we need to do discussion on that. Could we just go to a vote?
Be up to the.
Yeah.
Okay.
Members, is there any discussion?
I just want to know how to spell her last name.
Okay, well, you and the majority of the world, it's B as a boy, Olcik.
Very
And it's
good.
just like there's an H there, but there isn't.
Yeah.
All right.
Yeah.
I use the traditional Slovak spelling because going through life, people called me Bolsik or Balsik or whatever, and that was in lots of different variations. So the Slovak, CIK on there. So, all righty. So, I guess, can we just do a show of hands?
It's gotta be roll call.
Yeah, because
Roll
we have,
call. Okay, so Sue.
Aye.
Well, let's have the motion. Pardon me.
Yeah.
Sue, would you like to make it official motion?
Yes, I make a motion to have Veronica Bolchik be the chair of the Council for Human Services.
Seconded.
Okay, so, a roll call on that. We'll start the other direction. Kelly,
Aye.
Sarah,
Aye.
Suzanne,
Aye.
Amanda,
Aye.
Sue,
Aye.
Tara,
Aye.
and, myself, I with, thank you very much. So motion passes. Thank you.
Thank you.
All right, now we need a motion for a co-chair. We have a motion, we have someone from the floor would like to make a motion for a nomination for a co-chair.
I can nominate myself if that is, I can make a motion to nominate myself.
Okay. all
I
right.
second that motion.
Okay, so here we go. So Sue,
Aye.
just,
but-
she volunteered ahead of time, so we're all here.
okay, Amanda,
Aye.
right, Suzanne,
Aye.
Kelly,
Aye.
Sarah,
Aye.
Aye.
and myself, Veronica, I. So thank you very much, Sue, for accepting the nomination. So we now have continuation of chair and co-chair. With that, I know that this year coming up is going to be a year of changes. And I gladly accepted, actually, let me take gladly back. I've accepted this role gladly, knowing that we've got lots of work to do and for continuation of where we started. So thank you. So we're going to turn over to our Human Services Director for a brief report, so we can then get into the rest of our agenda.
So primary, I'm gonna keep it primarily to, in what is it, in item number 6, I'll keep it primarily just on my current activities, and then we'll segue into what has been one of the larger activities I went up to, which is this report. Big news is that we received confirmation of the state vaccination program for COVID and flu. We're signing up for those now. We're anticipating monthly COVID clinics with the possibility of 1 or 2 doubled up months right before respiratory disease season shows up. We'll start communicating those out as soon as we receive confirmation, and as soon as we make sure that they're already using the updated formula, because last year we had a large issue where they had to cancel a whole bunch of them because they changed the vaccine formulation after we had scheduled them. Following that, we're waiting for next week when the public health director, Rocky Miramontes, will start. He'll be here Tuesday, and then I hope to introduce him to all the boards that are adjacent or directly underneath his stuff. So you'll probably see him on this board at some point. His background is in a lot of the things that are. His background is in a lot of the things that we have working right now, so I'm pretty hopeful and optimistic about him starting. Past that, we are getting the RFP finalized for discussion and contract review committee. I sent that out along with the rubric to everybody. I think the best way for us to look at it is right now we should be familiarizing ourselves with the current RFP and rubric. And then we'll be able to pick up and hit the ground running, because the segue that I'm now about to make into item number 7, if everybody's good, is that we received the preliminary report.
Okay.
Not even preliminary report. We had a discussion about the initial findings of the report. It will be likely adopted by the select board as it was paid for via strategic fund money, which is under their aegis. The initial results were basically what we were thinking they were. There needs to be a slightly more formalized process. We need to adopt kind of we in this case being the CHS, an additional oversight role to help both do outreach to people about the program we have and to assist in forming the priorities as laid out by the town charter for this. Primarily what this is gonna mean operationally for us is that in spring, after the CRC process has happened, and after we've made the recommendations for this year, using kind of the stripped down version of what we've been doing for the last couple of years in contract review committee. After that, we're going to have a facilitated workshop between CHS and CRC, likely with some select board participation. The facilitation will likely be done by Raftellus, and it will give us a specific list of responsibilities, rules, guidelines, and responsibility. Did I say responsibilities twice? Responsibilities as shared between the two committees that do the oversight here. I'll get into the more specific findings of the initial report in just a second, but the one thing I want to mention is that they will be submitting the formal report to the select board, and then they'll be coming to Nantucket in October, in early October, while the RFPs are out to agencies, and they will be giving an initial presentation both here, both to the CRC, the CHS, and to members of the select board. What's probably gonna happen is that we'll have a joint meeting between CHS and CRC. We have to post for both because it will be an object of deliberation, and hopefully we'll have a quorum of both bodies. And then there will be a few people from select board who were the people who were helpful in getting this through the strategic plan process for funding. So I believe we currently have October 9th selected. I'll get confirmation of that, and there's some wiggle room because the consultants will be on island for a few days, and I thought it would be ideal to get this in person or as close to in person as we can. Just because I think there's going to be some questions and requests for clarification, and I have found that works better in person. I'll have a confirmed date for you guys for when that is, but it should be the first week or so of October, I think. Whatever week this 7th falls on. So those are the two things that we have set up. Those are all pending the official acceptance of the report by the select board, which will happen, I believe. There was nothing particularly shocking in the report, and with your permission, I can move on to discussing the initial part of the report if you'd like.
Right.
The most interesting things for me were the benchmarking. They benchmarked us against 8 other communities in Massachusetts and in other Greenwich, and then I believe there was one in southern New Hampshire. It might have been Exeter. I can double check. They compared us to them in terms of per capita human services spending through a grant process. They compared us by demographics, by population, and then they had a informal assessment of like how rural you were. Provincetown was also on that one. And the two other closest communities to Nantucket in terms of demographics and in terms of spending were Greenwich and Provincetown. In terms of per capita spending in human services through identified grant sources, I'll get into why that's an important factor in just an important phrase in just a second. But per capita spending on human services through grants was massively higher on Nantucket than any of the communities that were injured.
If I can interrupt, when you say massively higher, can you give me an idea of that?
So-
Because I'm blown away by this.
The per capita spending as quantified through this metric, which is gonna be important, keep that in mind, is that $57 were spent per person through grant funding. The next closest one was Provincetown at 26.
Wow,
So we are nearly double Provincetown in per capita spending,
wow.
which was a shock to. Then the other closest comparisons in terms of these communities, Greenwich was, I think, at 19 to 20. Now, there is a major difference between Nantucket and all of those other areas. And you can see that it's along a spectrum with P-Town right in the middle. That other quantity is rural nature, how rural we are. We are a county and a municipality, which means that all of the human service spending per capita is in this one category. Whereas Provincetown, Greenwich, the other communities on the Cape that we were compared to all have county level spending, federal level spending, and state spending that is not captured in this metric. So it is an interesting result, but I think it is a combination of the massive increase in expense for delivering services on Nantucket, the lack of larger organizations' presence on the island. And I think that it still fits with our assessment that there is more funding and more outreach necessary to connect programs to this funding. And that's how I'm going to be presenting this as we move forward. I think there is a combination of factors about Nantucket that require it to have a higher amount from this fund because of the hesitance for state and federal agencies to directly deliver services to Nantucket due to the higher cost. Basically, all of our human service spending, or a large percent of our human service spending, is captured in that $50 per person range. Whereas in the other similar communities, it is not captured in that. There are additional dollars spent per person, which I think will still put us below. Especially when you're adapting, you're adapting for the cost of service delivery. $1 delivering services goes much further in every other community than it does here. Additional from that, there were a couple of different suggestions offered in terms of how to improve efficiency on this. They primarily come in the increased transparency and communication in the beginning part of the grant process. And then more follow-up, more tailored reporting, more effective communication of outcomes, and then building in some sort of measured impact metric and some sort of measured efficiency metric. And then, of course, just more participation from the CHS in terms of determining what the rubric will look like for the next year, working with CRC to evaluate programs based on their performance on each year, and then more open houses, more diversification of responsibility, so it isn't all bottlenecked in one or two individuals in each of those particular points. So that process will happen when we iron out exactly how that's going to look. That'll happen with CRC and CHS and external consultants to facilitate the process. We'll have an explicit document, and this should happen in one or two meetings in the spring to early fall. I was sort of hoping that I'd get a complete report with templates and how to kind of go on about it ahead of this grant cycle. That's unfortunately not going to be the case. And the other thing the consultants really said is that you have to build it. If you don't build it, it won't work for you. You have to get the buy-in from everybody involved. And the best way to do that is to have everybody involved in the process of building up the new guidelines. That's basically the very high level summary of what that was. There'll be a lot more details. There'll be a slideshow. There'll be a chance for feedback directly from these members of this and CRC. And it's going to be sort of set up in such a way that you'll have a good idea of what's going on. With this presentation in early October, we'll be able to plan for what CHS's role is going to be in the spring. Excuse me. And then the official written document will be presented to us on acceptance by the select board, and I'll send that out to you guys as soon as I get it. And my guess is it's going to be after that early October, that the written document will be presented. If only because it has to go through the select board acceptance process and then be added to the official record of the town. So I think that we should have a much closer idea on on what the outcome of the study was in early October. I wish we had it now because I think that would be helpful for us discussing things going forward. But it is what it is at this point.
So Jericho, if I can ask, so the meeting that'll take place the beginning of October will basically be to review what the results of their work has been. After that, and I mean collectively, will customize from there what our process is going to be. And that will then be presented to the select board?
So the report with the recommendations will be accepted after it's presented to us by select board. Then the primary recommendation from that is a facilitated master plan on how the contract review committee allocates funds and how the reporting structure goes back towards CHS. And so how priorities should be set by CHS. And then the CRC process is a more constrained grant evaluation cycle and reporting oversight. That's gonna be the general receipt, but that's not we send out the letter, we send out notification for letters of intent on day X, we accept them by day Y. The chair of this board has this responsibility, so what we're gonna have to do in the spring, after the CRC process is done, is spend a few, probably 1 or 2 meetings as a group with facilitators in order to actually get a final document, which then will be how we operate. It'll just be an explicit roadmap on how a CRC cycle goes and what the duties and responsibilities of CHS is to CRC, what CRC is to CHS, and then sort of how you guys participate in the process of setting priorities for the grant cycle, and then how the CRC evaluates and determines best value for dollar. This is the traditional way that this structure was set up back when it was added to the charter in the 80s. But there was a long period of time where there was no quorum in the CHS and there was no human services director. So all of those responsibilities fall solely onto the contract review committee. And now this is sort of a return to the original structure as intended by the charter. One thing that was suggested, and probably the biggest swing from the consultants in terms of recommendations, was a bylaw or charter change amendment to unify CHS and CRC into one body. Because one of the other things that the benchmark found was that we are unique among all communities surveyed in that we split this up into 2 different sections.
Yeah.
One of the other things that came out of the discussion with the consultants in this is finding ways to move certain type of programming out of grant cycle and make it more of a competitive bidding for services as we do in other ways. And then methods to work with finance to improve the ability of smaller agencies to do startup grants, and kind of partition the big bucket of money into X for new programs, Y for this particular task, Z for an additional task. And that's where you and CRC would sort that out in the fall towards the end of the fiscal year, so that I can use the results of that discussion to make a budgetary request based on needs as a city. But really the biggest thing, and what I think is going to eat up the Council on Human Services time the most as a part of this, is the need for a needs assessment. But I see a couple of hands, so I'm gonna pause.
Yes. I see, Sarah, we'll start with you.
No, I'm sorry.
Oh,
Oh, that's. I'm sorry about that. Okay. Sue, I saw your hand up.
So Jericho, you may not have the answer to this question, but when you talk about making the CRC and the CH marrying them, I forget how you phrased it, but would that mean that there wouldn't be I don't want to say outsiders, that's not the right way, but like the way that the CRC is formed is that there are delegates from other town
Right.
committees.
Yeah.
So
Any change in this structure, and I'm hesitant on this proposal for a few times, but they felt the need to say it. The. Anything that we do along that structurally requires a bylaw modification that goes through town meeting. I prefer not to do that because it can be difficult and get erratic, and I think the split between these two agents, these two organizations is useful here, because this organization should be oversight over CRC. But then the primary work, I think, of this body is also to communicate out what we do. B, to assist in a ongoing and regular needs assessment program, which I think is something that is going to be really heavily weighted on you, on us here. And then also to get additional feedback from the community in terms of what needs are. Like the informal sense of needs and the more direct, like, problem referral response thing, because a ton of people only find programming that will help them on Nantucket via word of mouth. And this is more mouths that should be pretty intimately connected to what the town program is. But I don't have a great answer to that. I would prefer not to push in that. If we were gonna do that, we'd have to write the bylaw. We'd have to get it evaluated through legal, et cetera, et cetera. And I have no experience with that. I don't know the likelihood of it passing. And I prefer not to stick my hand in a running motor. Basically, that's how that works.
Right.
Just happening, you know?
Anyone else up on the screen, questions before we turn to in person? Okay, Tara?
It sounds to me like the recommendation is what is done in Greenwich. Which is, as I think I mentioned at one of the prior meetings, it is the Board of Human Services, which I am a member of, that does the reviews and does the allocations for both, for the grants. From the town.
Mhm.
There's a separate organization that deals with government allocations that some members of the Board of Human Services are representative on that board. But it sounds to me like what they're suggesting is kind of modeling of what we do in
I
Greenwich.
think Greenwich is in a position of being sort of, if not best practices, then close to it.
Yeah.
There are some differences in the way that state laws impact who can be allocating the money. That
Yeah.
mean that what we do here would be fundamentally different from how it's done in Greenwich in
Yeah.
terms of the financial management. The
Right.
money cannot be held in, this grant money, because it is tax collected and under the rules of procurement law in Massachusetts, cannot be distributed in the same way that it is in
Yeah.
Connecticut. It will, there will always be a role for committee and council members who are part of town boards in the allocation process. All of the financial component of this must be handled through existing, so bylaw can change the structure of these two boards, but we can't change state procurement law
Yeah.
on our level, so they're it will all be coming out as checks from from town finance. For
Yeah.
example. That is outside of the scope of anything that we can change in a town bylaw alteration. And again, I think this is the most unlikely suggestion out of these. I would, but it has some pros, but I think that before I get too deep into my speculative reading on what this report is going to say, based on the conversation we had, that's sort of, these are questions that we should ask now so we can think about them. But this is what you asked in that October meeting with the consultants.
Yeah.
Right.
How these recommendations go, where they have seen them before, and then they should have additional information in terms of the benchmarking with other communities, which should be helpful. But all of this stuff is interesting. In terms of that, it is not gonna be this is what you do report, it's gonna be, here's how you build something that works report. And I think that is the only way you can do it in this kind of situation.
Right.
Yeah.
because we have to customize it for the individual needs of our own community. If, Amanda?
Can I just have one, so Jericho, you had mentioned something about a community assessment.
Yeah.
So is that,
Sorry, go ahead.
oh, so is that like doing another community assessment like we did originally for with GPS?
So this would be significantly broad. GPS was a gaps study. Well, it became a gap study. But GPS was focused on a single sector and they were not quantifying so much as qualifying and then sort of synthesizing the various streams of information. This is a straightforward needs assessment that we had, that the town did one about 15 years ago. This is a new version, an updated version of that. It would be broader than the one that the hospital recently did. It would be more based in terms of what are the human services needs across the island, which would include things that are outside of the scope of the grant process, but will give us hard numbers that we can use to determine what the need is. I have
we-
never, go ahead.
Do we know who would be conducting this and who would be initiating it or no?
No, not yet. The recommendation is added to a variety of other recommendations for a broad needs assessment. The money for this, like this is once we get through this fiscal year, my next probable major strategic plan thing is going to be facilitating, not even facilitating, it would be starting the process of finding out who is going to end up doing that needs assessment. And it will probably be another year before the needs assessment starts.
Yeah.
And if it's, from what I'm told, the last needs assessment was a 6 months, so it was like 6 months process just for data collection.
Yeah.
But this is going to open up, once the needs assessment is completed, that opens up a large public collection of data that can be used to support grants internally for the town, externally to
Sure.
other agencies and funding sources, and will allow us to establish the water line to see if our effects are going, if we're fighting the tide successfully or if it's rising. Kind of murdered that metaphor, sorry.
No, I got
Okay.
the
Yeah,
idea,
yeah.
but that is extremely important because as, you know, I sit here and I take it all in, we have a gut feel for how well things are being done, but we do not have any data that says X amount of dollars was put toward this and we have increased
Yeah.
participation, or we have X amount went there and
Yeah.
status
yeah,
quo or negative, you know.
Yeah.
Amanda?
Just piggybacking on what you were just shared. So I guess before we go into the next cycle, you know, in November, for the current money that people have spent, there's no data collection that we ask of, right?
In terms of like the CRC grant reporting,
Yeah, I mean, there's that, but I mean, is that really fine-tuned and looked at and?
no.
Well,
And
if I can jump in on that, the only thing that we request is a quarterly report.
Hmm.
And that quarterly report, going into the next cycle is one of the things that I hope CRC will have the opportunity to look at of standardizing what we want to see coming back, because right now, even though there's very loose guidelines, what we get in a quarterly report is all over the place. And I don't think we're really getting a lot of the answers that we need, but it's on us to ask as opposed to on the agency
Yeah.
to give.
Yeah. Yeah.
And then I guess
So-
and my question is, do we take into, and we probably, I don't think we do, because it sounds like we have to do a much better job at data collection. But then the
Yes.
other issue is, do we look at each organization and what they obtain from other like fundraisers and donors? You know,
There-
because I think that that's something that needs to be looked at, because some organizations are, you know, making a lot of money off their events, which is wonderful, but then others aren't. So it's like, maybe we need to give more to a different organization.
Yeah.
And that's what, you know, I personally have struggled with, because one of the metrics you can say is, first of all, looking at where the other sources are coming from, and we have some organizations here that don't have the ability to raise funds.
Yeah.
Where you have others that have a hefty organization behind them that just do fundraising. And then one of the things that we do question, and I'm saying from now CRC, is how much is spent on fundraising?
Yeah,
That if you are spending $90 on fundraising to make $10, is that really a fundraising,
Yeah.
or is it a separate organization of, it's, and I'm not saying it's not good stuff, but it's, you have to look at the whole picture.
yeah,
The other thing is, like, there's organizations that don't do fundraising because
They
it
all-
may be two people. You may have one person on salary, you may not even have anybody on salary, but it's a volunteer organization. So unless money falls from the sky, you know, you can't really compare that. The other issue is, I know that we want to look at cost grant per grant dollars given per number of people served.
mhm,
And that's a wonderful metric, but it also comes with a downside for innovative programs or new programs, because we have, and I'm thinking of something we have funded for the past couple of years, that we are hoping it's going to take off, and we say, well, we understand you've got X amount of dollars, but you're getting a handful of people. We've given suggestions of how to do more outreach or whatever, but maybe after a certain time, maybe it's just not a need that's out there, even though we think it's a need and it sounds, we're all passionate about it, but maybe the need isn't that great. So going back to a needs assessment, and everything all does mesh, it does come together. But it also brings a lot of questions in how we do this job. Yeah.
When I think, if I may.
Yeah.
I think that the important thing for us to stress, and the important thing for all of us to stress, is there's not gonna be one metric that determines the value of a program. And that we need to be looking at these as programs, not funding organizations.
Yeah.
That was a very strong subtext to the discussion we had, which is that we, while the health and wellness of the organization is important, we need to, from the point of view of the grant process, be evaluating the program that they're presenting us, not the agency as a whole.
Yeah.
Because we're not forensic accountants. We're not, like, you know, this is not, you know, we, if somebody really wants to snow the contract review committee with their reporting or whatever, nobody on any of those committees will be able to, like, we're not authorized to do an audit. You know, like, we can't get a third person in to do that. We can withhold funds, we can strongly word things, but I think, like, what we have to do is realize that the system that we had set up has been going for 30 years, and that it, like anything that's been running for 30 years, needs a tune-up. And that's, I look at this as a tune-up to a system that has successfully delivered programming to people that they would never have been able to get anywhere else. Things like the sliding fee scale, things like the independent therapists, they could be run much better, but in terms of dollars going to people and people getting services that they wouldn't without those dollars, those are valuable programs. We need to figure out ways to incentivize new programming, incentivize new ways of addressing problems, but we also need to acknowledge that there's certain things that are going to need to be, like, there's a limit to what can be, like, that per capita number isn't gonna do it.
yeah,
So one of the other things that they suggested is that when the metrics would have to be multifaceted.
Yeah.
Basically, like, the rubric would have to be, that per capita number will be one part of the decision to award the grant, and so on and so forth. I have been looking at this as a signal as a way to communicate. My background is in education. I'm used to grading papers. A rubric is grading a paper. You have to be consistent,
Mhm.
transparent in what your grading process is, and then the people, the students is the wrong metaphor here, because these are working professionals, but you gotta communicate transparently to them, or else you're not gonna get what you want.
Right, right.
So.
Right.
That's a big chunk of what we're doing, and then, honestly, for the last 2 years, there has been like staffing chaos. On my side, Ann Medina, who had run the administrative side of a lot of the CRC for 20 years, it retired. Like there's a big gap in institutional knowledge, and then there's a rapidly changing nonprofit environment on Nantucket. So we have to adapt alongside that. We have to work with nonprofits, because what we want and what we need to think about is we want services delivered to residents that they need, and we want more of those. So we want to spend as little money as possible so we can get as much services out as
Yeah.
possible.
Yeah.
And remember that a dollar spent, like a per person expenditure for a safe place, will have a huge number of other services than a yoga, a day at a wellness program that has 8 encounter hours. It doesn't requires one qualified professional to educate multiple people, whereas a single client of a place like Safe Place requires 5 or 6 professionals for a much longer task to handle much more complex situations. So you have to use metrics, use evidence, you have to ask the agencies to be collecting information from their clients if you can, if it works that way. And then you need to be comparing that to the need an identified need, just to make it as bulletproof as possible in terms of justifying that spending. All of this is, I think everybody in this meeting believes and has good reason to believe that there is unmet need on Nantucket. I think that's a fair assessment. We just need to show our work so that when we ask for more money, we get it, basically. And I do genuinely believe that there is a shortfall in funding for human services, but I have learned that you must really make your presentation tight and really justify it, and use whatever evidence you can gather, both on an individual efficacy level of the programming and in a usage level.
2 questions. The GPS, when was that done? Amanda, are you familiar with that?
Yeah, it was done in, I think 2020. Yeah.
I got the final report like right after I started, basically. I think we started talking about it. So yeah, I think I started at 2020. So
And who did that?
So-
Who?
yes,
Yeah, it was initiated by Fairwinds, and then they, coordinated with the hospital. And they hired Government Performance Solutions to do a study, which they did also in Vail. And then other organizations joined on, but as Jericho said, it really identified the gaps, and a lot of it wasn't a surprise. I think we're all aware of what we need on this island that we don't have,
Right.
but it was
But-
helpful information.
I'm sorry, say that again?
It was very helpful information. It'd be interesting to see, because I know the hospital just recently did one. Be interesting to see what they found out from their study, which was something different, but
that was a community. What was that, Sarah?
Sarah?
It's called the CHINA, the Community Health Needs Assessment, and it's a
CHIN?
CHNA, Community Health
Okay,
Yeah.
yeah.
Needs Assessment. And I believe it's required every 3 years. And I looked at it, I was asked to give some feedback. I know we had it translated into Spanish and Brazilian Portuguese. And I haven't seen the results yet. I think we have a new a project manager at the hospital who I think is analyzing that info right now, or those data right now. But as I listen to this conversation, I am also, I'm sort of wondering, was the 2020 study, was that done over a 6-month period too? And was it stratified by, year round, seasonal people? Like, what are those parameters, not to jump too far ahead?
I mean, from my recall, it was, looking at different organizations and, asking them questions. And I think they did some community-wide questions, but I don't know how well the response was in terms of like community members. And that's really what we need as well. Like, it's one thing for organizations to give feedback, but you really need to hear it from the community.
Yeah, the timing of the GPS study, which I want to clarify, the GPS study was mental health kind of
Yeah.
specific.
Right.
The community input part was, I think, primarily offered during the summer, so it was just really crappy timing. It was just the way the process went. And the results were illuminated the problems we thought we had. I mean, it was a good study in that respect, but it was mental health related. The CHINA is health related, but it's still leaving out a lot of these
Other
Um,
areas.
other
I think-
areas.
Other
I mean,
needs.
but certainly though, like homelessness and food insecurity is part of health. Like, I don't mean to diminish that, but we kind of need a really broad-based.
And I think you're right, Sue. I think, the timing, there's limited time in order to get the data.
Yeah.
Really need to be thoughtful about that and do it over a much longer period of time and not in the middle of the summer when all the people that live here are working like.
Too busy. Yeah.
Overwhelmed, yeah.
Yeah.
And I know the GPS study was much less quantitative than they were hoping it would be. And I know that the full community needs assessment would include sort of the, more focus on social determinants of health. And like sort of the long trail of lack of services on Nantucket and how that interferes with the the delivery of human services. I think it will also potentially, and this is me speculating at this point, but it may also expand into like transportation or other sectors of the town. Because the previous one had a methodology that had sort of a Maslow's hierarchy of needs built into it. In the RFP and rubric that I sent out, you'll see the table that was the output of that for level 1 needs and level 2 needs. And that's 15 years old. The nomenclature has moved on. The methodology for collecting data has changed. And then I think that the problems are different than they were 15 years ago, or at least they've evolved.
Right.
Well, and we're more cognizant of certain problems, like transportation is I mean, at least in the circles that I'm running in, transportation is a huge barrier to accessing services for a lot of people I deal with. And that just wasn't, I don't know, it wasn't that talked about. Well, I haven't been here 15 years, but 11 years, that wasn't what we were talking about. And now it's what we're starting to address instead of not talking about.
We didn't have public transportation on Nantucket until I think the 90s, right, Suzanne? When did the wave start? Yeah,
Until when? 1990s?
90s, when did the wave get started? When did the?
No, that was even later.
It was like late. Well, yeah.
But
mean, we did-
I left the island for between 2003 and got back in 2012, so it might have happened in there.
I think
When
it
he
was-
came in 12, it was here though, yeah,
It was.
Yeah,
yeah.
there was a summer only, well, this is a bit, sorry, a bit. tangential.
2018,
Was it 2018 was the wave? And then,
April 27,
It was
2018.
late.
and then
Wow.
NERDA buses were going, I know there was a summertime bus service that was, a third of something. Okay, sorry, not super relevant to this.
Well,
but-
what just this one topic of transportation, I'm a select board junkie. I watch every meeting and I gather a lot of information that way. We have a wonderful new director who's been here, a year or so, and look at the free bus service to this summer and the ridership that's gone up. And he's got plans and he has, I know that they sought money for housing for their their employees, et cetera, but we need to, what we do and come up with has to be communicated to the entire Nantucket town organization, because I'm thinking if we know that transportation is a problem, do we ever meet with this person to say, it's wonderful you've done all these things, but let's talk about maybe the needs that you don't see on the top level, but let's talk about a person who is food insecure that is in Mattakit during the winter. There's no way for them to come into town. The food pantry provides home delivery, but that was established for a different need. But so let's, talk about this. So it's bringing up lots of bells are going off in my head.
Well, one of the things that needs assessment does is it gets people talking and it gives them a shared vernacular with which to
Right.
address these things. And from the GPS study, we got some pretty legitimate multi-agency collaboration that did not, to my knowledge, exist beforehand. And especially a repeating needs assessment means that we will have there will be a conversation around the collection of data. There will be a conversation around its synthesis and presentation. There will be necessarily work between agencies in order to fulfill the requirements of the study, which is where all these conversations come from. Like I worked, sometimes it's just as simple as moving offices, because the health department was right next to the NERDA office downtown until we moved next door to 131. And during that time, I walked out and would see people
Right.
who worked for, and then there was just
Water cooler conversation.
yeah, and
Like there was
That's how you
communication
yeah.
taking place.
and, when, especially with a new person who is implementing a pretty big expansion in services for transportation in Merida. I didn't really, I'm not bugging in there and I'm otherwise busy. But these kinds of needs assessment provide an excuse, a motivation, and a justification for both parties to take on more work in the short term to reduce everybody's work and do better service. I think that, there is no way around the fact that we need to do a serious attempt at quantifying what the problems are, developing a shared language for how we address them, and then incentivizing and facilitating agencies that don't normally see the crossover between what they do
Yeah.
to see it. That's a big chunk. If you are the transportation director for the town of Nantucket, you're maybe not thinking about food delivery.
Right.
That's not part of the initial mission
not.
statement.
No.
So figuring out how to do that, figuring out how to tie in existing transportation grants for senior travel, for specific illnesses, and to put that all in a central spot. Because the biggest thing, and Sue and Amanda, you'll both back me up on this, the biggest thing was that people didn't know what the services were that they had available.
Yeah.
And that there was no centralized way for people to communicate what they had or what they needed. And that's what this should be. Sorry, that's hard
Okay.
taken off by the way.
Yes.
Sorry.
That's okay.
No, you're good.
Turbine.
Thank you.
Titan City. I'm glad that is totally out of my remit, anything wind turbine related.
Well, no, it falls within our purview also. I believe everything on
Yeah.
this island
Is a human
becomes a human services issue.
But I think on the certainly my report and the discussion and goals, I think we are hopping ahead of what is going to be presented to us in October. And I think that there might be additional stuff they find in the next couple of months. What I'd like to, and with your permission, is to just go to item 8, review grant application and rubric. We sort of already got into that.
Right.
But what I would like to ask you guys is just, and 2 of you have already done this in extreme depth, just give a review over that. Take a special eye to the rubric and think about, because this is gonna be what I think the major ongoing task of the CHS is priority setting in the end of the fiscal year to inform the RFP for the next year, in terms of like the big thing we all have to sit down and like produce something as a result of. It's gonna be this RFP and this rubric, and it's gonna be working with the CRC so that their evaluation meets with what your guys' priorities are.
Right.
I don't think there's any major, like, I don't think you need to pour through it and look over it. Half of it is boilerplate that we use for any town contract. The last section and the rubric that's in there are kind of what we should take a peek at. And then, you know, I think that September's meeting is gonna be. I mean, we'll have to talk about that later, but September's meeting might be follow up on that, reports on the, like, who is initially submitted to the contract review committee, depending on when we have it, the RFP should be out. By the time we have our meeting, if it's roughly the same as the same part of the month as now.
Right.
But I think that's gonna end up being a big chunk of what we do and how we kind of build in two sets of eyes looking on the grant program without them overlapping, so that we can make sure that the priorities in one match with the priorities in the other, and then match with whatever we determine for this needs assessment.
Right, right. Sort of pull it together at this point, because we are nearing the end and we've got some other things. From what I've gathered and knowledge of how this is happening, we are going to tweak the process for 2026.
The fiscal
Okay,
year.
because right now we're in fiscal year 2025. I get confused. We call it 2025, even though we're still 2024. So it goes 2024, July till June 2020, July 1, 2024 to June 30th, 2025. So we are now, the grant cycle that's starting will be from July 25 to June of 26. That cycle is only going to get tweaking.
So the grants that are being evaluated now will use a tweaked and refined version of the existing process.
Right.
Where I want to keep it as close to what we've been doing so that it's like the control group. The
Right.
control setting, so that we can then, when we are looking at what the output comes in the spring, and when we're tinkering and tweaking this, then we'll be able to kind of like, we'll have this is how the old way should go, and then we'll be able to figure out how that should work and improve. And I really do think it's gonna be 95%
Right.
making explicit what was implied.
Okay, Amanda?
My question is, if we're gonna tweak it a little bit, how are we gonna educate everyone that's filling out these grants about the tweak? Because I think some of the feedback I've heard is that there's not a lot of like education up front about the process and how to fill out the application and a venue where you can ask questions. And so given that, you know, it's almost September, how are we gonna like roll that out? And like, does it behoove us to have a meeting where people can like review it ahead of time and then we can go over and ask questions?
And that's excellent. We've talked about that in CRC, Amanda, that we really need to, once we get the application, the RFP ready, which includes the rubric, so the grant application is out there. There needs to be an information session, and that would be the best thing, if we could have an information session where organizations can come. This is a presentation done, this is what, you know, this looks like, this is what we're looking for, etc. That's part of it, and I hope that we'll be able to do that this cycle. The other thing that I would like to see is outreach to people that don't realize that this is there, because in my 2 cycles, we have, except for the youth behavioral health, which was a whole nother, it was a cycle off a cycle and outreach that went there. We typically get the same people applying every year, And maybe there's one or two new innovative programs, but I know that there's people and programs on the island that don't know about this. So there's got to be two kinds of outreach. Outreach to the people that have been doing it, and also somehow that we reach people saying, listen, this process is in place. Come and hear about it. And if, there's something, can apply.
Well, and then a couple of things that among the tweaks now is an explicit timeline that doubles the amount of time that agencies have to complete the grant, and then will be some immediate feedback from me for office hours during the grant writing process. I don't know how we would configure like a CRC meeting around like open office hours, but I know that like I'll be doing more to make it to provide opportunities for questions ahead of time. And then we'll have a explicit rubric. We're gonna have predetermined questions, which are communicated to the agencies before they come in for their defense. And then we'll have all of the members of CRC will have the specific rubric that we've just finalized in our mind when we're doing the initial, like when we publicize it. So there's gonna be minor tweaks that are mostly timeline and communication related. A change in the way that we communicate out about these awards, both initially and like both before the RFP goes out. And then we're gonna do additional advertising, because by law, we're mandated to run 2 weeks of an ad in the Inky Mirror, and that's the only outreach we are mandated to do on this. This year, we're gonna do that for longer, and we're gonna do additional social media outreach, and I'm gonna do direct mailing to everybody who has applied to us in the past. So there's gonna be some more on my end. But the unfortunate truth is the tweaks aren't fundamentally gonna change this year. We got the recommendations too late. We started too late this year. So we're playing catch up. And we can't alter the system too much now because we're using last year's fiscal allocation of money for it. So there's only so much we can do to change this without it potentially going off the rails in the middle of a cycle. So we're gonna do 1 year with as refined a version of the existing system as we can do. And then when we have a more time and a longer time frame to actually get the revisions and adjustments in place, we'll do that, then.
Well, I hope that this conversation, we continue the next CRC meeting, because having that information session, I really would like to see that happen. Because we want good grants to be coming in. And the only way that's gonna happen is if everyone's on the same page, and this is what we're looking for, it's the information that we need, et cetera. So thank you for bringing that up, Amanda, for sure.
Can I
Yes.
make another suggestion? I mean, I don't know if we're able to, but I think putting it in the Current and the Daybreak is a great way to get it out there, because everyone has access to that. Because Inky's one thing, but if you don't subscribe, you don't have access to it. And I think, I agree with you. I think we need to get it out there so that for people that aren't aware of it, that they have the opportunity to apply.
So I'm going to reach out to both agencies to see if I can have it. They've been both the Current and the Daybreak have been really good about doing PSAs and community awareness things for me. So I'm gonna reach out to both of them and just be much more vocal about the process of when it starts, where you get it, and how, like, what is sort of suggested of it. But we are legally mandated to run the advertisement in the paper of record. That's
Right.
why, that's sort of like, that's why that's.
Right, but the others can be done. It's not that it's prohibited.
No, absolutely not. This is, all of these things are public record. These all are to be shared. There's no restrictions on discussion. for advertising, except for my advertising budget.
Right.
Uh,
Do you have an advertising
like-
budget?
enough to do one ad in the, in the current or the daybreak.
Okay,
That's on the budget adjustment for next fiscal year.
okay. All right. Because technically, we don't have a budget.
No.
The
This would be-
CHS and CRC does not have a
No,
budget.
this would be the human services budget, like for outreach and communication. Which is going to ultimately be answerable to the new Health and Human Service Director. So,
Okay.
it's gonna,
Oh, I was
So-
just gonna throw in that, while we don't have a budget, anyone who has social media and is remotely savvy about it can share out anything that the town's Health and Human Services Department puts out. So hopefully when the RFP goes out, I wonder if you could, share the digital image for us
so
to put into our own social media if we choose.
the current plan is to restart the Health and Human Services social media presence on both Instagram and on, I believe Twitter is the other account we have. And then we will be doing, that'll be a hub, one of the hubs for outreach around this. It's also how I plan on announcing the recommendations are done and that sort of thing. So it is, there's going to be an expansion of outreach around this program in a variety of different ways.
We'll be on TikTok next year, I'm so sure of it.
Oh, I'm not gonna do any dances. That's the only thing I will not do for the good of the people of Nantucket.
We could have a flash mob,
Flash.
right?
Uh,
Can we, any other,
I just want to
Discussion.
make a comment that I think Amanda's point is really well taken. I don't see the Inquirer Mirror myself very often, but I get Daybreak and Nantucket, what's it called? Current in my email every morning. And I notice that people, whenever I'm on the shuttle, or whatever, people are looking at all the Instagram and all that stuff. And though everybody's got social media, except for grandmothers, really old grandmothers.
some
we're
grandmothers
working
have
on-
it.
we're working on that.
No, I know,
too.
that's why I kind of added that, but
I have we had a social media class down at the senior center, that I'm gonna try and get going again, just to, I wanna see what gets posted, like the garden club will have some fantastic pictures posted.
Okay,
Uh,
great. All right, on to other business. Any other business? Okay. With that, our next meeting should be on, pulling up the calendar, is on September 26th. So 4 PM on September 26th. Any other business?
no,
Okay. With that, can I have a motion to adjourn?
I would make that motion.
Okay. Second, Suzanne, second,
yeah,
All right.
second.
all right, so, motion to adjourn, Sue,
Aye.
Amanda Wright,
Aye.
Suzanne Keating,
I
Sarah Wright,
Aye.
Kelly Seven,
Aye.
and myself, Veronica, so, good meeting. And see everyone next month or somewhere in between.
Okay.
Thank you.
Thank you all.
Bye-bye.
Bye, everyone.
Bye-bye.